Morning, this is Donna Evans with Core Medical. Today I'm going to speak to you about a good heart health diet. Nutrition and heart health is the topic for today, so let's get started. So let's talk about what is a good diet. In my teaching and thinking, there are no good or bad foods. Your diet should be well-rounded, all the food groups. However, we do want to focus on whole grains, fruits and vegetables, and lean proteins. And then we always want to limit sugar, salt, and saturated fat. So what are the heart health essentials? I think it's very important to get adequate fiber in our diet. Fiber helps with good GI flow. It helps to keep a nice, clean, healthy gut. Also encourage low sugar, low sodium. Whether you're having heart health issues or you're just a healthy person, low sugar and low sodium is beneficial for everyone. Adequate calories. I do believe that we all need calories for survival. However, too many can be detrimental in your overall health and weight gain, which can just have a domino effect on your health. So I do believe in fat and moderation, a mix of all good fats, and then limit your saturated fats. And then, of course, decrease processed foods. Processed foods just cause inflammation in your body. So I always talk about the pie of life, and with heart health and good nutrition, it's not just about what you eat, it is about the whole pie of life. So we talk about sleep, we talk about emotional issues, we talk about how much you exercise, and how all of these just work together to be a well-oiled machine. So again, just to recap, your healthy fats, which are those that do not include the saturated fats, getting adequate sleep. A lot of research shows that getting 7 hours of sleep is good. For those who get less, unless that's your normal, you can cause kind of chronic distress on your body. Getting exercise, anything is better than nothing, but having a good exercise routine, including cardiovascular exercise, as well as any kind of resistance or weight training, is also encouraged. Getting enough protein in to build your lean muscle mass and not break down the muscle mass, but you do want to try to break down the excess calories. Hydration. Hydration is key. Being even a small amount of dehydration can cause a lower in your metabolism. And then we've also talked about the whole grains. Anything that's whole and it's more from the earth um, way of being. I always say eating more from the earth in the whole form versus something that is already processed and broken down is always a better option. So 7 tips for a healthy heart. We just keep reiterating and recapping. Regular exercise, getting your heart rate up, keeping it up, monitoring your weight, reading food labels. Reading food labels can be your best friend when you go to the grocery store and you're trying to make wise decisions. Again, that's where you can find the sodium content, you can find the sugar content, how much fat does it have, how many calories does it have, fiber. All those components can be found on the food label. And then also on the food label, you want to get your eye on the ingredient list, because if the ingredients list a lot of sugars, um, high fructose corn syrups, all the things that are just kind of added in with no good nutrient value to nourish your body, that's where you can kind of decide whether this is a better for you item, or if you need to compare food labels to find ones that are higher in fiber, lower in sodium. Again, just taking the time and knowing how to read your food labels are very important. Um, don't smoke, that's a no-brainer. Nothing positive comes out of that. Setting your weight goals, maybe you're trying to lose weight. A lot of research does show that losing just 10% of your current body weight can help with blood pressure. It can help with improving your blood sugars, your hemoglobin A1Cs. It can help on the way you feel, the weight that you, maybe your knees hurt or your back hurt from carrying extra weight. Again, the research shows just setting your initial goal at 10% of your body weight will show outcomes in the numbers and how you feel. Follow the 80-20 rule. The 80-20 rule with nutrition is 80% of the time you're on track and you're doing the right thing, and then the 20% we allow for special occasions. Maybe it's your birthday or a celebration, or it's the holidays. So if you follow the 80-20 rule, meaning 80% of the time you're doing well and you're nourishing your body in the way that you need to, the 20% you may fall off the wagon, but ensure yourself that you get right back on. Avoiding processed foods, again, going back to reading food labels, taking time in the grocery store, trying to shop on the parameters versus the inner aisles. That's where you're going to find the more whole foods. Everything is just so processed now, and you feel like all the good stuff is taken out and all the bad stuff is put in for it to be very tasteful. But again, just knowing how to read your food labels, and just avoiding processed foods as much as you can. Again, back to the 80-20 rule. And then one thing I do want to go back and add when we talk about avoiding processed foods and choosing things that are more whole grains. Your gut is your second brain of your body, because a lot of times you have your brain telling your gut, something is not right, or vice versa. So you're getting something sweet in your gut, you're having all this sugar, these neurotransmitters go off in your brain saying, I want more. So just to know that there truly is a connection, and you want to aim for about 25 grams or more of fiber per day to keep a good gut health. We'll just talk about this on the fats. There's lots of controversy out there right now. The research is still ongoing. Some people are more sensitive to cholesterol intake than others, but for the most part, dietary cholesterol doesn't have a whole lot to do with your blood serum cholesterol. So when you're monitoring and making changes in your diet to try to lower your cholesterol, you want to really cue into saturated fat, because that can be a main culprit in elevating your cholesterol. And again, the emphasis on high fiber, because fiber can act like a binder and help your body excrete excess cholesterol if needed. Seed oils, they do appear in a lot of processed foods, so that's what a lot of the hype is about right now. The seed oils, you have to really look and see how are they processed, how are they made. They do contain omega-6. Too much omega-6 can cause inflammation. You want to stick more with the mono and polyunsaturated fats. These are ones that have good heart health, but you also need to monitor how much fat you take in. I don't want to say don't take in any fat, because I believe that we need to get all the macros in from your protein and your fat and your carbohydrates, but we just need to choose the better, and then make sure that we disperse them correctly. As far as fats, about 25% of your diet from fat, less than about 10% of that or less from saturated fat are the guidelines. So again, there's been conflicting evidence in the past 5 years. As long as you're getting a well-rounded diet, again, all the food groups, watching your total calorie intake, that's where the whole pie of life, again, everything just kind of plays a role in heart health. So again, just on the fats, I want to reiterate about saturated fat. When again, watching the saturated fat intake, it is linked to increasing not only your total cholesterol, but your LDL cholesterol. Think of L as in lousy, H as in healthy. Your HDL, that's the number you want to be. For women, I think it's about 40 or higher, but the higher the number, the better. And exercise is real key in that. And you want to make sure that you get in your omega-3s. You'll see a lot of marketing tools, a lot of foods when you go into the supermarket. They're just trying to sell you something. So again, even though it says lower in saturated fat, high in omega-3s. Go back to your food labels and actually look and see how much you have. Again, too much omega-6 can cause inflammation. And you want to choose fats for different reasons. As far as cooking, you'll need those with the higher smoke points that can tolerate the higher heat. The omega-3 is going to be in your fatty fish. Your monos are going to be in your olive oils, canola oils, avocado oils. So you can get them from different sources, and just having a good mix for heart health is important. So again, you only get one heart, so let's take care of it and let's put into practice all the little things that we can do, outside of our environment, outside of our genetics, or, for hereditary issues. So again, you get one heart. Let's take care of it. Making all these small changes over time can make really big incomes. Whether again you're losing the 10% body weight, you're exercising, you're burning the calories, you're getting your endorphins up, you're moving. Again, all of these just work together with insulin resistance, which is a big topic right now with inflammation. Those two tend to go hand in hand with heart health right now. So watching all of your food additives, your preservatives, eating more from the earth to get a cleaner food item, making sure you sleep well, watching your stress levels. What are you doing to alleviate stress? Are you exercising? Are you, seeking counseling if you need? So again, all of these work together for better heart health. So again, through Core Medical, we were able to help with most all of these. We do have nutrition counseling, we have physical therapy, we have mental health for just day-to-day counseling, and then of course Rachel Shelby, our primary provider, can help if you need any of your labs checked, to get a good baseline to do your biometrics, and then um, she can refer you to Jared for physical therapy. How do I start an exercise program? How do I help these ailments? And then also refer to myself, who I can help you make better nutritional choices to actually nourish your body, to have a healthier heart through cleaner eating, making wiser choices, and decreasing overall inflammation. Okay, thank you.